Do you have an anxiety disorder? What's the difference between ordinary anxiety and problematic anxiety? Well, if you're interested in a few quick tips on the world of worrying, then keep listening. I'm Dr. Kerry-Ann Williams. I'm a child psychiatrist and a podcast host, and this is your mental health boost. Anxiety is basically the body's alarm system. And just like a house alarm or fire alarm, it goes off when there's a problem. And that's really helpful when you're in danger. But just like a house alarm or a fire alarm, it can also go off when no real danger exists. Sometimes your alarm is too sensitive, just like a car alarm that goes off when somebody walks by. That is a false alarm. And the only way to deal with a false alarm is either to reset the sensitivity level or to go in and investigate whether real danger exists, like when you determine that it was burnt popcorn that set off the smoke detector. Here's your tip number 1. Anxiety has 3 parts: your anxious thoughts, your anxious feelings, and your anxious behaviors. Traditional anxiety treatments like cognitive behavioral therapy or CBT seek to address 1 or 2 of these things with the hope that it will help the whole triad. So, in your tip number 1, I want you to ask yourself the question, what bothers you the most? Is it your anxious thoughts, your anxious feelings, or the things that you do because of your anxiety? Here's your second tip. Ask yourself the question, what does anxiety stop me from doing? The answer to this question will reveal how anxiety is hindering your life and preventing you from achieving what you hope to achieve. For example, some people have social anxiety. This is primarily a fear of being embarrassed in public, and this can lead to avoidance of public speaking or even attending events. And this can lead to loneliness and social isolation. In that situation, you'd want to ask yourself the question, where would I go and what would I do if I didn't feel anxious? Here's the third tip. Avoidance makes anxiety worse. Despite the feeling of short-term relief that comes from avoiding a feared situation, the long-term effect is that the fear gets bigger and digs in deep. One of the best-known strategies for managing anxiety is exposure therapy. In exposure therapy, a trained professional works with you to develop a hierarchy of fears and then slowly goes through each step until you gain mastery over avoidance. The next tip is incorporate relaxation strategies into your lifestyle. Here's the thing. Anxiety and fear can be held in the body even when you're not thinking about it. I work with patients all the time who might say, in the moment, they don't believe they're anxious. But when I start to guide them through a relaxation exercise, they're surprised at how tense their muscles are. Anxious tension can be held in the body even when you're not thinking anxious thoughts. So, tip number 4 is to incorporate stress relievers into your schedule. For example, going for a walk after lunch, or going window shopping, or even just sitting and drinking a cup of tea without multitasking. The 5th tip I have is for those of you out there who are chronic worriers, those of you who find it difficult to control your worries. What the professionals recommend is that you write down your primary worries, and then you write some arguments for and against the things that you fear. Ask yourself the question, what's the likelihood that what you fear is actually going to happen? What is the evidence for it? And if it does happen, what would you do? Could you handle it? And sometimes, depending on what the fear is, it's helpful to make a plan. For example, if you fear getting the coronavirus, then make a plan for what you would do if you got the coronavirus. Who would you call, etc. Lastly, sometimes medications can help. It doesn't have to be forever, but sometimes medications can help with anxiety. In particular, there's a class of medications called selective serotonin reuptake inhibitors, or SSRIs, that some people find helpful. With anxiety, though, it is often better to start with individual therapy first, and then if it's not sufficient or if your therapist recommends, then go to see a psychiatrist for a medication evaluation. So that's it from me. What strategies have you used for your anxiety? If you found this video helpful, then share it with others in your circle. And if you're interested in hearing more, then subscribe to my channel. Take care.